A new report says pollution is a greater global threat than war, terrorism, addiction, and disease. According to data from a coalition of researchers, pollution was responsible for 8.8 million premature deaths between 2015 and 2022. It reduced worldwide life expectancy by 2.9 years. The authors say there is an immediate need to better monitor these pollutants and study how exposure to them raises cardiovascular risks. Dr. Céline Gounder, CBS News medical contributor and an editor-at-large for public health at KFF, joins us from Washington. Doctor, thank you for being with us. The report found air pollution to be one of the main drivers of these health complications. Explain how that happens and what are the main health complications that result from this pollution?
Well, the main driver of air pollution remains fossil fuels, the burning of fossil fuels. But you do have other sources of pollution, including other forms of combustion. You were just talking about wildfires earlier in the report today. That's also a significant source of air pollution. And what happens is when you inhale this, it causes significant stress to your cardiovascular system, to your lungs, as well as other organs, and increases your risk for cardiovascular disease. It's now estimated that 1 in 5 deaths from cardiovascular disease are attributable to air pollution.
And are there particular groups that are at risk of these pollution-related illnesses? And also, is there anything they can do, those particular groups?
Well, there are certain groups. It's not really surprising that it would be the very young and the very old who would be at increased risk, pregnant women as well, and then lower income communities that tend to be more exposed to air pollution, whether they perhaps live closer to a highway or to a chemical manufacturing plant. They do tend to be in areas where there is a higher risk and higher exposure.
And what about temperature? That's been shown also to increase risk of cardiovascular illness. Why is that, and how much of a threat does that pose?
Well, when you have increasing temperatures, your body compensates by having a higher heart rate. You might actually feel this when you're outside. When it's hot, that your heart might be beating more quickly. It's also squeezing stronger, so that's putting some real stress on your heart. People also get dehydrated when it's hot out, and that further stresses your cardiovascular system. And when we have a heat wave, we can see as much as a 10% increase in deaths from cardiovascular disease, which is really quite significant when you consider cardiovascular disease is one of the most important causes of death worldwide.
And finally, doctor, what should be done with all of this information? What can be done at a government level or even an individual level to protect people based on this new information?
Well, at a government level, there are things, for example, having more shade in big cities to address heat islands, planting more trees, that sort of thing. You have some municipalities, Miami, for example, that passed a law that would require employers to provide work breaks, shade, water breaks, and so on for people who work outside. At the same time, you have certain states like Texas and Florida who've actually outlawed such regulations. So there's sort of a back and forth at the governmental level about how to deal with these issues. At an individual level, talk to your doctor, especially if you have cardiovascular disease, about what some of the issues might be with your medications. That can sometimes be a little bit tricky. Be drinking water, be aware of where you can get shade, and also be aware of where cooling centers are in the summer.
Dr. Céline Gounder in Washington, thank you so much.